It can be tough out there in general practice land. And to mark Stress Awareness Month in April, the BMA released a document called Managing Workload and Taking Time to Reflect on Wellbeing for GP Practices. They suggest that we make it a monthly practice to reflect with our teams on well-being. They also present practical suggestions for managing workload more effectively in practices. It all might even help you achieve your mandated QOF staff wellbeing points. Gandhi and I took a look at their advice and have split our thoughts into 2 episodes. This is part 1, where we reflect on how to implement the BMA advice about wellbeing. Look out for part 2, where we discuss their advice on managing workload. Let's tech enhance your primary care and learning.
Hello, EGP learners, and welcome to this episode. We're looking at the BMA guidance on wellbeing and workload for primary care. It's an interesting document, isn't it, Andy?
Yeah, it is. I think it's actually a really helpful little document to help practices, to help guide how practices engage with their staff well-being, essentially. So shall we bring it up on screen and kick off?
Yeah.
I guess.
Well, let's have a look at it, shall we?
Yeah, so three-page document, managing workload and taking time to reflect on wellbeing for GP practices. And really what the BMA have done here is they've pulled together a lot of the guidance that they've already produced in various different areas, workload, safe working, managing wellbeing, and supporting your staff. And they've put it all together in sort of just a 3-page pack, really. And where I think this would be quite useful for my practice, for example, is when we're having a staff meeting or we make some protected time to talk about well-being, it can just help us structure that conversation. It's got some suggestions that you could use that sort of time to talk about some of their existing guidelines, like that around safe working, like that around managing workload, like that around reducing inappropriate work within general practice, or looking at the 10 tips to maintain and support well-being within your practice. So it's really just giving you some ideas, really, a little toolkit. So I think it's really, really helpful, and looking forward to breaking down some of the things that are referenced within it.
I must admit, there has been some pushback on this particular document because of some of the stuff it talks about. And I think people potentially have taken it in some ways the wrong way at times, because it talks about both well-being and workload, which are 2 slightly separate things, but also massively linked in the impact they can have on each other. But similar to Andy, I think there is some really sensible stuff in here. There's some stuff, if you just take it in isolation, it probably feels a bit pedantic or a bit, like the QOF wellbeing itself, tick boxy and that kind of stuff, but actually it can be really useful, and we're going to have a look at that in more detail now for you. So it does signpost you to a few other resources throughout this document. There's a couple that we do need to focus on because they are slightly different as well, but it does mention obviously that this is in particular being generated to support practices with the QOF wellbeing activity, the QIA activity that we have to do. So really do bear that in mind for your practice or for your network, that this can be a really useful tool to look at from that perspective. How did you want to kick us off, Andy?
Yeah, well, I think really it just references a few different documents that could be discussed as part of reflection time with the team. So I guess looking at what those resources are and just introducing people to those, if they've not already seen them, might be a good way to go through the document. So, I mean, shall we look at the BMA's advice around workload, for example?
Yeah, let's go for it.
So, workload control. Oh, we've linked through this. We've seen this document before, actually, and this provides. This is actually quite useful. If you're having these conversations with PPG, for example, this is where I find some of these BMA documents and web pages that have good statistics in are really helpful to pop up on a screen and have a discussion around. So it talks to the current situation and where it's heading, and then it gives.
Maybe to zoom in a little bit, Andy, on that one.
Yeah, that's true. Let's zoom in at the top, and then it basically acts as a toolkit. It gives you an action plan for trying to address some of the common workload practices, problems within practices. I think it's something for people to go away and look at and use. Really, I don't think we need to go into too much detail today, unless there was anything you wanted to focus on. It's just got some nice little visualizations and tools to help you think about how to prioritize and and where to focus efforts to reduce inappropriate workload. So, just an example of the sorts of things it links out to. Safe working in general practice. Now, this is something I've seen. We had a local LMC event, didn't we, a few weeks ago
Yeah.
when we had a member of the GPC come out and speak to us about how general practice will cope with the new GP access um, requirements. And they were really leaning into this safe working guidance that they produced. Um, I think the main part here, I'm trying to find and lift the bit where it talks about it, but they talk about limiting contacts a day to safe levels and give a level of 28 as a 28 typical complexity contacts
Hmm.
at the maximum within a standard safe day, which I think is really interesting. I think many of us will routinely and have routinely worked beyond that in the past.
Hmm.
Uh, but but it's quite helpful to have a body like the BMA, defining what is safe limits, essentially. Do you have
Hmm.
any reaction? You've probably seen and navigated through this particular safe working guidance before, Gandhi. What's your opinion?
I think it's useful to have the guidance. I know many people often challenge around the implementation of the guidance, and that's the real aspect that many people struggle with. But I think it also comes down to, as ever, it's things like change management, about how you look at the process, and also communication with patients in terms of priorities of care and stuff. It does explain a lot of that in the guidance itself and how you could look at doing it, but obviously that initial, how do you do it, is a real challenge, I think, for many people, myself included. But there is some interesting stuff in there. It talks a bit more about waiting lists, and we've covered that in
Yeah.
previous streams around how that can be a mechanism to help in primary care, and also focusing on other, or sources of care for patients. It mentions PPGs, so you mentioned about the earlier documents, how the graphics can be useful, and actually in the BMA document that we're looking at, it mentions about talking to your PPGs as well. So interaction with patient groups can be a really powerful tool to help you in practice to understand the challenges we are all facing in general practice, both as a clinician, but especially as a patient as well, hearing their sides.
Absolutely. So, and that's really good. And I'd encourage people to, to spend some time with that. I think the use of this document really is just is kind of, if you're looking for something, useful and
Mm.
fairly impactful to do without too much preparation as part of your QOF QI to look at well-being, or you're having a general meeting about well-being at your practice, you can just bring up some of these things and just talk through them, as a practice, and generate some action points. And I think that
Hmm.
that would actually be quite a useful activity. Staff will
Sure.
feel listened to, and you'll probably have some action points at the end that are supported by the BMA, our trade union body. So I think that that's really good. The sorts of other things that they have here are, so there's some guidance around, very recent guidance around meeting the GP access rule changes, and talking about what we have a video about the statutory
Yeah.
in, instrument that was used to change the core contract and the changes that that has brought about. But they summarize that here, and it's quite a short article, particularly if you're, we're all going to be changing our access models, I guess, in some way by what will be Monday at the time of recording. It will have
Yeah.
happened by the time you're seeing this, and that may or may not have gone smoothly. So, revisiting this guidance and summary around what you need to do, which is not the same as what has been in the press. What the GP surgeries need to deliver is very different to the impression that's been created in the press. Perhaps very different to what patients might be expecting if they're ringing up and applying some pressure to the reception team. So going through this document as a practice, might be very useful if that is a big source of stress and is affecting your staff well-being, at this point in time. So yeah, that's useful. I guess already. So something that I quite liked was, they talk about their top 10 tips to help maintain and support well-being of your colleagues and yourself. And they give those 10 tips here, but there's a nice graphic again, which I think can be used to, let's find where it is. It can be used, as the basis, as a part or
Hmm.
all of a staff meeting to talk about, do we do these things? They're really good conversation starters. So it might be worth going around. Should we take them in turns, Gandhi, and see
Yeah.
whether we feel we're doing these things? So some of these are quite soft, and I guess as medics, we're trained to be a little bit, tough on ourselves and each other.
Hmm.
Certainly, that's what medical school training felt like 20 years ago when I was going through the process.
Definitely.
Maybe different now. But it's just simple things like check in with each other, let someone know if you're struggling, look out for signs that colleagues might be in need of help. I think we've become quite good at that as practice, actually.
Better,
I'll
yeah.
often ask, actually, are you okay? After a meeting, if someone looks quiet or they're not their
Mhm.
normal self, or they've been spending a lot of time in their room. And actually, sometimes I'm the one who spends more time in my room, or is quieter in meetings when I'm normally quite chatty, and people will say, you okay? And I think people do that a lot more than they used to. So I think that's
Mhm.
good. Number two, Gandhi.
So I can't actually see what number 2 is, Andy. It's
I
the
will
senior staff.
zoom.
There we
I
are.
will
Yeah.
zoom in.
Senior staff, I think this is an interesting one, that it's about being more visible, particularly, I think, relevant to you and I as partners. Obviously, we generally are leaders of the practice in that consistency, but I think it's also depending on the structure of your practice. So if you have a fairly large practice, actually, this may be delegated to other members of staff, so your staff managers, your team leaders, whether that's your nursing team, pharmacy team, GP team. I know over the past few months, I've been trying to make myself more visible, not only to the clinical side of the teamwork, but also the administrative side as well. So, spending more time in the reception, talking to the receptionist, making sure that during peak hours when I've got the capacity, that I'm actually there in the reception area as well to help understand some of the things. And I think that can really be a powerful tool to at least be more visible, because then they feel they've got the comfort and the knowledge of that support.
Absolutely, yeah. And with the changes coming in the coming weeks with access, we've speaking to our doctors, and particularly the duty doctor, to be more visible to the
Mm,
reception team and be in their space, as they potentially have difficult conversations with patients about the access
yeah.
changes. Yeah. Number three, rotate staff between high and low stress activities. I think we do this in practice, actually. I'm just thinking about the GP rota. We have duty
Mm,
days, we have non-duty days. We encourage people to do what are potentially lower intensity work, like joint injections,
mhm,
minor surgery. Some of that planned care can be different in terms of the stress levels, which is good. And then particularly actually the lead for care homes can be quite stressful at our practice, and we rotate that every few months because we do want to provide continuity. So someone needs to do it for a few months so that you get the benefits of continuity. But we rotate that as well. And I guess in the non-clinical staff, we take
mm,
care with our reception rota that the front desk and the telephones are really difficult, and then
yeah,
activities like recall, where people are proactively calling patients or dealing with more administered paper-based tasks, are potentially less stress inducing. So we do try and rotate things around and make sure that staff are skilled so that they can be rotated around those different areas. Do you do anything particularly to rotate staff, Gandhi?
I think, like you say, it's finding a balance for the workload that you're doing. So yeah, we will try and equally share out aspects of things like triage, things like on calls and that kind of stuff. But it's recognizing everybody also has a difference in their strengths and their challenges. So I think potentially one thing I would suggest practice look at, if you're particularly looking at the QoF QI elements of this, is maybe have a discussion with each of your members of staff about the different roles they have, and ask them to allocate what do they feel is high stress and what do they feel is low stress, because actually you may find a difference depending on the individuals as well. What I may think may be high stress may be completely different to what you may think is high stress, and actually that exercise may help to contribute to having a more harmonious breadth of what you're trying to achieve in general practice, and for your team in particular, because everyone is an individual at the end of the day as well. So I don't know, that would be my suggestion when looking at this particular tool.
I think that's really good. I mean, you can always spend a whole or part of a session looking at that.
Mhm.
Uh, so number four.
Yeah, I think pairing up less experienced staff with more experienced staff. I mean, we do that for the clinical team. So I supervise, other members of my clinical team, and I kind of make myself available to them. We have, particular debrief sessions, both formally and informally. And also we've done that with our admin teams as well. So we've got, leaders within those teams who mentor other members. And then for those leaders, we've also got other networks. And it's building that structure, isn't it, Andy, to try and help your workforce, because actually everybody needs support and mentorship in a sense as well. And that can be a really powerful tool to help understand the challenges you've got within practice as well.
Yeah, absolutely. I know an exercise that we've wanted to do for a long time, and we probably don't have time to do it now, was to actually sit receptionists, with GPs, so that they can see what happens in the GP surgery, and also
Mm,
help develop a bit more of a deeper, connection, with the
mm,
GPs. We've always wanted to do that. We've never done it in it's difficult to free up the resource to do it, isn't it? But it would be really lovely. Um,
Mhm.
Number 5, arrange small group support and safe spaces for staff to speak openly. Um, I mean, we have a coffee room that's actually quite well used at lunchtime, where I think a lot of this occurs organically. I guess I suppose that is different
Yeah,
to making a specific space that is designed for that. We do have whole staff town halls. I think it's something that we could maybe look at. Although I guess we do have, we have a nurses meeting where the nurses will talk
yeah.
together, and we have reception team meetings. So I think we go some way to creating these spaces for people to have small group discussions and feel safe to share things and support one another. Do you have a similar structure of meetings, Gandhi?
So we have some formal meetings, like you mentioned. We have a nurses meeting, we have practice meetings, that kind of stuff. We try and offer some additional ones when it's needed. So obviously, when there's been certain challenges, the last one I can definitely remember is the strep A challenge that we had in practice. Obviously, that was a significant additional pressure that we were all facing. So having some just catch-up meetings with the staff, more frequently than we normally would have done, just to help explain some of the change that we're having to do, some of the access issues and that kind of stuff, was quite useful and things. So I think it is important to have those kind of support mechanisms there, and that kind of ability to flip on and flip off those kind of additional contacts if you need to.
Hmm. Gandhi, do you have free tea and coffee and snacks at your practice?
So we have free tea, coffee, and what you call it, cordial drinks and stuff. So the partners provide that for the staff. Occasionally, so at least probably once a week or maybe once every couple of weeks, I'll go off and buy some extra snacks and stuff. I mean, we also have quite a supportive environment. So people bring in things when it's their birthdays. People bring in things just ad hoc as well, just some snacks and that kind of stuff. I'm contemplating going for cake day. That's one of the things I'm looking at developing for our practice as a well-being thing. So having a dedicated day where somebody brings in some treat for the entire workforce as a kind of like a collaborative tool and stuff. And you know what, cake is always nice, despite what certain clinicians may feel on Twitter and that kind of thing. So you know what, actually, it's a nice tool, and definitely on pinch days. So one of my favourite things to do, which partly because I want one as well, the really hot days, going out and getting some iced lollies for the
Yeah,
staff, just to cool everybody down.
yeah.
It's a yeah,
That
must do
that
in my head.
Yeah, those are all great. They often have a takeaway Friday at my practice, but I'm often not in on a Friday, so that's something I often miss out on. So I feel a bit hard done by. But that was number 6, wasn't it? Facilitate
Yeah.
access to food and drink and encourage to take a break. Do you want to do number 7, Gandhi?
So encouraging colleagues to connect and support within networks, and I think this is really important. It depends what you consider a network, but that could be within the practice, that could be outside of the practice. Having other people that you're leaning on. I think I'm a massive fan of this. One of the things I've instigated within our practice, so we have a semi-regular board game night for the team and stuff, and we've kind of started off small with the clinicians. We've now gone wider, so we've got more of the practice team. So on average, we get about 10 individuals attending these kind of events and stuff from the practice. It's a nice team building mechanism, but actually, it's important to develop those networks within the practice itself. So, what about your RS roles? How much engagement do you have with those members of the team? And actually, even cross practices in networks or outside of it, I think is also something worth developing. We've had a couple of locums turn up to some of our social meets and that kind of stuff as well, because they are part of the practice. So why not?
Yeah, I think these are good sort of within practices, and it's interesting that they talk about to connect with support networks, e.g., friends and family, as
Hmm.
well. So I guess that's about as an employer, you know, valuing people's connection with their friends and family outside of work as
Hmm.
well. I guess, and facilitating that. There might be family events and occasions that it's important for people to get to, and being mindful of that and not being restrictive. Um, so that's common sense, but it's worth
Hmm.
thinking about all of these things, isn't it? Um, Number 8, call on tried and tested healthy coping strategies. Okay, so um, I guess I guess we're using this tool to talk as practices, and some of these things are things that you can do as a practice or as a group, and that definitely can include physical exercise. But it's also these are things that people can do as individuals as well, can't they? And be responsible for their own physical exercise or walking in nature or
Hmm.
just ordinary relaxation techniques, essentially. But I guess it's using this tool as a way of having a conversation about, do people actually practice what they preach, in terms of physical activity, and eating well and getting enough sleep, and these things, and just reminding people that it's important, I guess. So number 9,
Mhm. Be kind to yourself and your colleagues. I mean, this kind of goes as common sense in some ways, but it's really hard to deal with common sense sometimes when you're really struggling and stuff. So I think it's some of the stuff you mentioned about being aware of other people around you, and that yes, you may be having a really bad day, but also everybody else may be having a really bad day. So two people having a bad day doesn't unfortunately lead to two wrongs equaling a right by any means. So being aware, I think, of how things may feel, and how can you not only help yourself by highlighting the fact that you're struggling, but also helping others who may also be struggling just as much, or if not more.
Yeah, absolutely. I guess it's being aware of, for me, this is being aware of the impact that your behavior might have on other people, and, being kind in that
Mm,
sense, but also I think reacting in a kind way when other people might be being a bit difficult,
mhm,
just that awareness that they might be having a bad day, and it's not necessarily that, they are wanting to direct, difficulties towards you. And then there's a whole, once you're aware of, these dynamics, you can start to deploy strategies to try and diffuse that. You might actually go
yeah,
back at the end of the day and, apologize, or just inquire if people are okay.
mhm,
Sometimes people mediate between other colleagues, at the practice, if they notice an issue, say, well, actually, Gandhi, he might have seemed a little bit, I noticed he was a little bit terse with you in that meeting, but
mm.
we're all under a lot of pressure. I'm sure he didn't mean that, if they look that way, but I'm sure you're never terse with colleagues, Gandhi. I'm sure
Fingers
you're
crossed
always
not.
serene.
Yeah.
And number 10, so this is the last one. So ensure colleagues are aware of where they can access support. And then they're talking about, this is from the BMA, so they're talking about their confidential support services. But there are all sorts of support services
Yeah.
available. And actually, you know, putting those up on a poster, in the staff areas of the practice is actually not a bad idea. That's
Mm,
something to
definitely
think
agree.
about, because sometimes you're not even aware that someone has a problem to go in the drawer and dig out the number and give it to them. Sometimes it's helpful if it's there for people just to see themselves, so that they can access the support.
Mhm. Absolutely agree. And I think it's also being aware of some of the local resources you may have. So we're fortunate in the Nottingham area, we also have something called the GPS. So it's a GP mentoring service that's also applicable, I believe, now to
Managers,
nurses and
I think
managers.
managers that we're expanding it to as well as
Yeah,
nurses.
exactly. So being aware of local resources, if not, I know that the BMA document, if you want to bring them up, Andy, shows some other ones. So I think there's the NHS practitioners app, in particular, it mentions in the
Yeah,
document.
that's
So it's got a link to it. There we are. But unfortunately, the link is broken. So you do have to search for it on the website, and it takes you to this page, the NHS Practitioner Mental Health Wellbeing app, which apparently is a customizable app that helps you with your well-being. And there's a free login code and stuff and things that you can access from there as well. So there are some additional tools it mentions. In particular, highly do recommend the NHS Practitioner Health group itself. The concept of this is a mechanism to help you, and there's loads of information on this website if you are struggling in primary care, to help you understand how you can navigate some of the challenges that you may be facing and stuff.
Hmm, absolutely.
So we,
So I think sometimes these things can feel a little bit
yeah.
soft, um, to us, or to people like me, at least. But actually, as as business owners and leaders within an organization, I think it is important, and I think it is beneficial to the employees and the performance of the organization to actually periodically spend some time on
Mm,
these things, even if to sometimes hard-headed medics it feels a little bit soft.
okay.
So
And if that is you and you think this is all a bit soft and woolly, okay, fair enough. This is Quaffwell being IAQI that you can have a look at, but then also there is some stuff on workloads that it mentions in this particular document. And I think that is also quite useful to have a look at, because it can further support some of the challenges you may be facing. So we're going to have a look at those now. And in particular, focus